Hello, all. This is Rosario, and this is my post for week 12 regarding integration of spirituality in online learning with the use of technology. Holistic care in nursing, that is the care of mind, body, and spirit, has been an integral part of the nursing discipline and has been recognized as a vital component in attaining optimal patient outcomes. The American Association of Colleges of Nursing, AACN, specifies spiritual care as a critical element to be included as one of the essentials in the baccalaureate nursing curriculum. The Joint Commission on Accreditation of Healthcare Organizations requires registered nurses to conduct spiritual assessments, identify spiritual distress, and provide spiritual support for patients. But even with the evidence supporting the importance of spirituality in achieving optimal patient outcomes, spirituality in nursing still faces many challenges and still goes unnoticed most of the time. One of the barriers identified is that nurses lack the education about spirituality, and they often feel inadequate to effectively address this aspect of patient care. This poses another challenge in nursing education on how faculty can find meaningful methods to teach spirituality throughout the curriculum. With the era of advancements in technology, this brings a new way and many strategies for the nurse faculty to be able to integrate faith and learning into the nursing curriculum. Teaching nursing students about spirituality with the use of new technologies can be a very effective way to integrate spiritual content within the curriculum. What students need to understand? Students need to understand how spirituality has been a very important part of the nursing discipline, way back from the time of Florence Nightingale. In the realm of holistic nursing, the patient is viewed as mind, body, and spirit. It is important that the students understand how addressing the spirituality component can improve patient outcomes. Studies indicate that nursing students who have self-awareness of their own spirituality are better able to care for the spiritual needs of others. Students need to identify their own spiritual needs and take care of their own developmental phase in spirituality before they can become effective spiritual caregivers. Assisting students to explore their own spiritual beliefs and where they stand in their own spirituality is a great foundation in learning how to meet the spiritual needs of others. In addition, studies have indicated that although students may learn holistic care in their nursing education, there is still an existing need for students to promote spiritual wholeness within themselves. Self-assessment and acceptance of one's spirituality are important steps that better prepare the students to address patients' own specific and diverse spiritual needs. A careful and thorough assessment of the patient's spiritual needs is necessary for the students to determine the plan of care for patient. In the assessment, the student will assess the patient's spiritual needs, the nature of the needs, the factors contributing to the needs, patient's certain beliefs, experiences, relationships, and the current illness, and how all of this influence the patient's needs. Students need to find out if patient needs help, in what way, and from whom. An important component of spiritual assessment is to determine to whom patient relates to as his God or as his supreme power or being. Respect for diversity in faith and religion is a vital component in spiritual caregiving. Spiritual assessment will guide the care for the spiritual needs of the patient. Student nurses can establish a therapeutic connection with patients by the ability to be present, the giving of self through therapeutic communication, empathetic listening, and also prayers, among others. In online learning, I will integrate spirituality in the lesson plan by including YouTube videos as part of the multimedia activity. Students will be asked to answer several questions that serve as assessment of their own spirituality. This will be posted in a discussion post and for the students to respond to at least 2 students in the class. There will be an assignment for students to write a 2-page paper as a critical reflection about the YouTube videos and also about their learning and realization after they did their own spiritual assessment. This will also serve as the evaluation of the students' learning about spiritual learning activity. Thank you all for watching. Have a good night.